Good morning, guys. I hope we're all sparkly. I'm going to tell you a story. A man goes to the doctor. He says, I'm tired. I've got brain fog. I'm a bit irritable. My mood is not what it used to be. I lack drive. I lack determination. My missus says I'm a pain in the arse. What could be wrong? Doctor thinks, sounds to me like it's depression. I'm going to get you to fill in this questionnaire and we're going to run some bloods. We'll do a full blood count to check to make sure you're not anemic. We'll do your thyroid, make sure you're not hypothyroid. Patient says, I've been reading about low testosterone. Doctor's antennae go straight up. Oh, I don't think you need that. Well, kind of fits all the symptoms. Yeah, but you know, it's part of natural aging. You know, if you have a nice healthy lifestyle, diet, train, you shouldn't have a problem with low testosterone. Yeah, doc, but it kind of fits all the symptoms. Well, there's that association with performance enhancing drugs. Use versus abuse. We don't want you to get too jacked, have that risk of prostate cancer, heart disease that's associated with testosterone replacement therapy. Yeah, but I've heard about this microdosing TRT. You know, normalizing your male androgen levels to help facilitate growth and repair, to help normalize physiology. Oh, it sounds like a scam to me. Does it, doc? Sounds logical to me. All right then. Let's test testosterone. So the blood results come back. And the levels are borderline. Well, your levels are borderline. You don't need testosterone replacement therapy. Well, it's interesting, doc, isn't it? Because actually, you know, the reference range wasn't created age specific. And we know that testosterone levels drop with age. Now, is there any biological advantage in having lower testosterone levels as you age? Doc saying, well, as we know, there's a risk of prostate cancer and heart disease. Well, doc, actually, according to the latest evidence, there isn't a risk. That data is outdated. And what you should be doing is always looking to reevaluate the current data to act in the best interests of your patient. So, here's an article written by the Men's Health Clinic. Peer reviewed, the latest evidence. Yeah, well, I'm just not comfortable prescribing you testosterone replacement therapy. What? Even if my levels are borderline and I've got all the symptoms of low testosterone? Yeah, well, you're in range. And within range is within range. It's kind of disappointing, doc, because I tick all the boxes and you are supposed to be acting in my best interests. Well, my hands are tied. Sorry. So what's that patient supposed to do? Well, we've said before, optimize your lifestyle, reduce stress, improve sleep, optimize your diet. I normally advocate a low carb, high fat diet and intermittent fasting. Intermittent fasting because, as we've discussed before, you're supposed to have a spike of testosterone and cortisol in the morning to be active, to then earn your reward. So it follows this diurnal pattern. And engage in physical exercise. Now, ironically, when you've actually got clinically low testosterone and you engage in heavy physical exercise, that excess catabolic demand on your body is going to do what to your testosterone levels? Disappointingly, it's going to decrease them further because we have this understanding of balance, anabolic versus catabolic. Anabolic processes predominate at nighttime. Catabolic processes predominate in the daytime. So when you've got low testosterone, Sometimes, despite doing all the things you're supposed to do, your levels will not rise. Now, we do know about functional hypogonadism. Could be environmental, could be been a naughty boy in the past. So what should you do? Well, lots of people actually reach to the internet, and they actually reach to those people that do abuse testosterone, and they go on to get underground lab testosterone, not realizing that TRT is very nuanced. You have to titrate your dose according to effect, and subtle changes in your dose can provide profound changes in your physiology and then psychology. So it is a rather complicated field. So as you guys know, we subscribe to microdosing, using a daily subcutaneous testosterone cypionate and HCG injections to help maximize normal physiology. That's the premise behind TRT. So these guys, underground lab testosterone, somebody's mixed it in their bathtub. The dose is inconsistent. Look, doc, I don't know why my levels were different with this batch and this batch, because they were the same batch. Well, it was the same label. It wasn't the same batch. So you can't trust these guys, unfortunately. Sad, but true. So what are you supposed to do? Well, you could reach out to a private TRT clinic, such as ours, and we will act in your best interests. We will provide you with safe, effective care and regularly monitor you so that you can go about your business. What I don't want you to be doing is obsessing about testosterone replacement therapy, because as it is an important foundation, it is only one part of this building block that we need to continue to build upon to grow and prosper. So place your trust in a clinic that knows what they're doing. What I want you to be doing is, guess what? Concentrating on living, going after it, looking after your lifestyle, your diet and your training. Leave the medicine to me, somebody that can be objective in something that is subjective to you because you're going through it. But it's super important to give a little bit of responsibility to me and take the rest of the responsibility that you owe to yourself to become a better person.